minute to just provide an overview of how Medicaid eligibility works. These are kind of the broad concepts, and in particular, the eligibility rules related to immigration status. So I'm going to run through that and then take people's questions, and then I'll hand it over to Christy to do more detail on Medicaid waiver programs. Next slide. So there are several what are called eligibility factors, or factors that people have to meet in order to qualify for Medicaid. And if you meet those factors, then you have a legal right to Medicaid. It's an entitlement. And there are some of these eligibility factors apply to all Medicaid programs, no matter what. And then we'll talk about some factors that apply depending on the program that you're eligible for. So the factors that apply to all Medicaid, no matter what program it is that you qualify for, are Colorado residency and factors related to citizenship or eligible immigration status. Residency is just declared. It just means that you intend to have your home in Colorado. You can go to the next slide. If you have your citizenship, then you can qualify for Medicaid if you meet the other factors. And also there are a lot of immigration statuses that can qualify somebody for coverage as well. In order to, if a person is a non-citizen, in order to determine if they qualify for Medicaid, you're going to ask two questions. One, you're going to ask whether they're a non-pregnant adult, a pregnant adult, or a child, because the eligibility rules are actually different for those different groups. And then you'll ask the applicant's immigration status. So go ahead and go to the next slide. So this slide basically lists the immigration statuses that can qualify somebody based on whether they're a non-pregnant adult or a pregnant adult or a child. For pregnant adults, the eligibility is more limited, but people can still qualify as non-citizens. Basically, they either have to have their green card, and there's what's called a 5-year bar that's applicable to green card holders. And this just means that people can't qualify until after they've had their green card for 5 years. So just take, a green card holding adult male who's not pregnant. Go back, please. He can't qualify for Medicaid if he's only had his green card for 2 years, but could qualify after he's had it for 5 or longer years, as long as he meets the other requirements. Also, non-pregnant adults can qualify in a range of statuses that are granted for humanitarian purposes. So this includes like refugees, people granted asylum. Those are the major categories, but there are a range of others, like temporary protected status, people with T visas or U visas, which are for victims of domestic violence and trafficking and other serious crimes. And in a lot of cases, just victims of domestic violence, regardless of their actual status, can qualify for Medicaid. For pregnant women and children, in the next column, actually a broader range of statuses can qualify these populations for coverage. All of the same ones, so green card holder, refugee, asylee, those can qualify, those individuals can qualify. And there's no 5-year bar applicable to children and pregnant women. So a pregnant woman who's had her green card for 2 years can qualify if she meets the other requirements. And then additionally, the big difference is that people who can basically establish lawful presence in the country, basically they have some kind of visa that allows them to be in the country, then they're often going to be able to qualify as children or pregnant women. So, big examples of this are people with a temporary work status, so like an H-2 visa or H-2A visa, or a temporary student visa, like an F-1 visa. As children and pregnant women, as long as you're lawfully present in the country, you likely can qualify for Medicaid if you meet the other requirements. The big Categories that don't qualify under this lawfully present standard are people who are undocumented and people who have deferred action for childhood arrival status. Those are the main ones that can't qualify as pregnant women and children. Next slide. So here's just a scenario that we can walk through to kind of show an example. It's the Martinez family, and the Martinez family is made up of Lucy, James, and Diana. Lucy is 30 years old, so she's an adult. James is 41 years old, so he's an adult. And Diana is 3, so she's a child. Lucy has a student visa, which is one of those temporary statuses. James has a temporary work visa, which is another temporary status, and Diana is a citizen. And then the last piece here is that Lucy is pregnant. And I won't have people volunteer answers, but if we walk through this, Lucy is a pregnant adult, and even though her statuses are only temporary, since she's pregnant, she can qualify for Medicaid if the other requirements.
Allison, that I interrupt. Someone in the chat is saying that they cannot listen to the interpretation, and I want to make sure people are listening to Hilda. Si no puedes escuchar en español por la interpretación, por favor, escribe en el chat ahora. If nobody types in the chat that they need help, I won't be able to know that we need to fix the interpretation. I'm going to give 5 seconds. Brienne dice que no puede escuchar. Brienne, tienes que dar clic en el globo que dice interpretación y luego seleccionar español. Lo mismo para Rosa. Si no dan clic en el globo de interpretación, no van a escuchar español. Rosa y Brienne, por favor, confirmen que ya escuchan español. Muchas gracias. Thank you, Allison. Looks like we are good to continue. Let me go back. Go ahead, Allison.
Okay. I'll just start at the beginning of this slide because I think with the example, if people missed some content, this example will help clarify some of the rules. So we're doing an example of the Martinez family, which is made up of Lucy, James, and Diana. Lucy is a pregnant adult. James is a 41-year-old non-pregnant adult, and Diana is a child who's a citizen. And so under these immigrant-related eligibility rules, Lucy can qualify even though because she's a pregnant adult and she has a temporary lawful present status. James can't qualify because his status is temporary and he's not, but he's not a pregnant adult. As a non-pregnant adult, he can only qualify if he's had his green card for 5 years or if he's in one of those humanitarian statuses like refugee, asylee, etc. Diana is a citizen, and so she can certainly qualify as well. Her status is a qualified status. Okay, next slide. Maybe I'll pause there and see, do people have questions about the immigration-related eligibility rules?
If you have questions at this point, please share the questions through the chat and I'll share them with Allison. English or Spanish is fine, I'll translate. I don't have to say that in Spanish, right?
Okay, I'll keep going. So, we just talked about 2 eligibility factors that apply regardless of the Medicaid program you are applying for. You have to be a resident of Colorado, meaning you have to have your home here, and you have to either be a citizen or be in one of those eligible immigration statuses. Then there are sort of 2 broad categories of Medicaid programs. One is we call it MAGI, that stands for Modified Adjusted Gross Income. But basically this is a Medicaid program for people who do not qualify or are not determined disabled. And their eligibility is based on, those factors that apply to everybody: residency and citizenship or immigration status, and income, for those programs. For non-MAGI programs, there's a range of these, and they're for people who qualify generally based on disability. And the factors can vary depending on which non-MAGI program we're talking about, but various of them look at income, they can look at assets, a lot of them look at assets, and then most of them look at disability as well. Next slide. Okay, so in order to determine income, you're going to ask 3 questions this time. You're going to ask, and this is for the MAGI programs, or whether, so you'll ask, what is the household income? Basically, what's the income of all the people in the household who are earning income? You'll ask how many people are in the applicant's household, who's all living in that household. And then you'll ask if the person applying for Medicaid is a non-pregnant child, a non-pregnant adult, or a pregnant person. Next slide. And so this, you'll often hear when talking about Medicaid income limit, that they'll have to be under a certain federal poverty level. And this table just kind of shows what those federal poverty levels are in dollars. And to look at, you'll look at, it shows that you'll look at family size. So over here, you see the household size column, and if it's a household of 3, the household income has to be under $2,365 for adults to qualify. That's under 133% of the federal poverty level. And I'll do an example of this to clarify. But in that same household of 3, the household income has to be under $2,525 for the month for children to qualify. And then for pregnant women in that household, the figures over here, the household income has to be below $3,467. So say, this household of 3, example household of 3 has a household income of $3,000 a month. The non-pregnant adults in the household won't qualify because that's above this $2,365. Children won't qualify because it's above $2,525. But if there's a pregnant woman in that 3-person household, she would qualify because it's under this number over here, 3,465. And this is just to sort of give you an idea of how the income test works for Medicaid. When you enter, or when you apply for Medicaid, you just enter your income in there, and the system should calculate this stuff for each person in the household. But knowing this information kind of gives you an idea of where sort of different families and the individuals in the household would fall if they, or when they apply. Next slide. So here's this example. In this example, the Garcia household is applying for Medicaid. The Garcias live in Colorado. They're all citizens, and no one has a disability. So that lets us know that those first 2 eligibility requirements are met. They have Colorado residency, and they're all citizens, so they can qualify based on those 2 factors. And since nobody has a disability, we're just going to look at their income to see whether they're eligible for a MAGI program. And then we look at the individuals in the household. We have a child, Lucy. We have Bessie, who's an adult, and we see that she's pregnant. So we have a pregnant adult, and then we have Larry, who's an adult, and he's not pregnant. It doesn't say that, but he's not pregnant in this example. Then so that's a household of 3. And then we'll look at what the income is. Bessie earns $1,500 and Larry earns $1,300. So total, the household income will be $2,800, right? So a household of 3 earning $2,800. And then if we can go back to the slide before. So when you look at this table to determine who's eligible, Bessie is a pregnant adult, so a household of 3 will look over here for Bessie. And so Bessie's eligible up to this income, $3,467. And that's more than the $2,800 that the family has. So they're underneath this limit, so she's eligible for coverage. If we look at Larry, he's a non-pregnant adult, so we'll look at this number over here, the $2,365. That's below $2,800. So their income exceeds this limit, so he won't be eligible for Medicaid. The child over here, this is also below $2,800. So the child likely won't be eligible either, but the pregnant mom will be. If you look at these numbers and you know the family's close, or you know even if you don't, we recommend that families apply, because there is a disregard. Basically, a certain portion of income is disregarded under this formula. And we don't want people to get too stuck on this, but this is just an example of kind of how they're looking at income in the MAGI program. So if we go back to the next slide. Yeah, for this family, if we just check, we can check that off. Eligible, or you know, Bessie is eligible because she is a Colorado resident, check. She's a citizen, check. She meets the income limit, check. That's how she qualifies for a MAGI program. Lucy, age 5, is a resident, check. Is a citizen, check. But she probably wouldn't qualify because of the income. Larry, same thing. Citizen or resident, check. Citizen, check. Probably won't qualify because of the income. And so different members of the household can fall in different sort of eligibility factors. The next slide is just another example. I don't think we need to go through it. So I'll just pause and, oh, it's not in Spanish anyway, so that's good. I'll just pause here for questions. And actually, before I pause for questions, I'll let people know that that income test for the MAGI programs, or for the non-MAGI programs, will work kind of the same, except usually the income limits are higher. You know, for people with disabilities, or the income limits are higher for people with disabilities. And then they'll also look at assets. Often, a lot of the asset limits are, you know, $2,000 for an individual. And then they'll also look at disability. And so there'll be a disability assessment involved in a lot of those MAGI programs. And the household can look different. For MAGI programs, the household that counts is basically who's on the tax return. They're really focusing on the tax household. For MAGI, the household can look different depending on the program. Okay, I'll pause there. And also, I'm planning for this to be the end of my presentation, and I'm going to jump off after I'm done. So definitely get your questions out now. If there are lingering questions that come up after I do jump off, I'm happy to follow up over email or anything like that.
Does anybody have any questions for Allison? This is super important information, and I just wanted to share this from Allison's standpoint before we went on to some of the waivers and some of the other pieces. I'm not seeing any questions. Okay, seeing none.
Questions through the chat. You have 5 seconds.
Oops, there's one.
Yep,
I am going to interpret the question then. The MAGI program is for someone with a disability?
MAGI is for people that do not have a determined disability. Non-MAGI is for people that qualify usually based on disability. And there are a range of those kinds of programs under Medicaid. And the waivers actually qualify as non-MAGI programs. So in order to qualify for a waiver, like Christy's going to talk about, it's a non-MAGI category, and you'll be assessed for disability in order to qualify for those programs.
And then the next question, can we get these slides after the session?
Yeah, definitely. Totally open to Francine sharing those.
Okay, you will receive the slides after this session. Should I move on? Okay, there is something else.
One more question.
My son is about to turn 21 years old in December. He has Medicaid, but he wants to apply for the CP waiver.
I would say let's hang on to that question, and we'll answer that in this next segment.
Okay.
If that's all right.
Any other questions? Rosa, your question will be answered later as we continue the presentation.
I guess so. Just the last point I'd leave you guys with is we hear a lot that people are told, you know, your child can't apply because he's not a citizen, or you can't qualify for Medicaid because you're not a citizen. If you do hear that, like, that is often not true. A big point of this presentation is that, you know, a lot of people can qualify with a lawful immigration status, especially pregnant women and children. The categories that can qualify somebody are pretty broad, and the only people who really can't qualify are people who are undocumented and people who have deferred action for childhood arrival status.
Okay, I guess that if there are not any other questions, we can continue with the presentation.
Okay. Thanks, everybody. I'm going to jump off here.
Thanks,
Thank you, Allison.
Appreciate you.
No problem.
Okie doke. So my name is Christy Blakely. I'm the Executive Director of Family Voices Colorado. We advocate for children with special health care needs, and we help families navigate the systems that they need for the services for their child. So hang on to the number. You may need to call. If you are a Spanish speaker, we can coordinate that with El Grupo Vida so that I can help answer questions. Okay, next slide. I happen to be the mom of an adult daughter with cerebral palsy, and I always felt like I needed a roadmap for her to figure out where I should be getting services and what I should be asking for and how I should be asking for them. And so I start this because I think I'm not alone in that feeling of just not knowing who to turn to or what roads to take in order to get the best for my daughter. And regardless of age, there are kids. And so we want to make sure we get the answers correct while we're navigating the systems. Next slide. So what I'm hoping that you'll hear today from what I'm going to talk about is the funding by age, that certain funding doors open and certain funding doors close based on the age of the kiddo. The difference between the Medicaid that you would get and what the waivers would offer, how to access Medicaid and the different services within Medicaid that Allison referred to, and then some Colorado resources. Go ahead, next slide. So when we talk about education and our kiddos with special healthcare needs are fitting into multiple systems, education is just one of those systems and one place that they get some services. And we think of this by age and stage, primarily because at 18, they become emancipated. So the mom that was asking about a 21-year-old, there's lots of things that need to happen between 18 and 21. So I'm going to go into that a little bit. But if you turn the slide one more, at the different ages, there are different documents or collaborative contracts about what you should be receiving for your child. So if you have a kiddo that's under 3 years of age and has some sort of a disability, has been in the neonatal intensive care unit or has had a rough start, you would be able to get what they call an IFSP, an individual family service plan. Most of the systems where you're going to get services are going to have that I document, that contract that says, this is what we're going to do for you, this is where your needs are, and this is how it's going to look. So we think of it this way as far as ages and stages, because through the ages and stages, education has I documents, but so do the community center boards in the developmental disability world. So you have to it gets confusing because our families are going through so many different systems. They don't always understand what they're getting from where. And so that's what I'm hoping to shed light on today. In the school system, you're going to have an IEP, an individual education plan. Or if you don't qualify, if your child doesn't qualify for an IEP, you may have a 504 plan, which supports the child to do specific tasks that other kiddos don't need to do. For example, a little longer bathroom break because they have to be cathetered, or a little longer time to eat lunch because they don't eat as fast as the others. So that would be the example of a 504 plan versus an IEP is more educationally based. And so that's where the reading and all of that comes in. So the IEP and the IFSP are your education documents through all the way until 21. Turn the page, please. Okay, so no matter what system you're going into, a system has eligibility. Who do they let through the door and who don't they? They have language and terms. They have laws and rules and guidance. They have procedural, those I documents that I talked about. You have a list of benefits. You have history, what's been done before, and then there's always an appeal process. I'm going to say that again. There is always an appeal process no matter what system you're in. So if Medicaid denies you a walker that your child needs, then we can appeal that denial through the system. So if you think about this system, this can be healthcare insurance, this could be schools, this could be vocational, this could be any number of things. So Medicaid, so just know that. Okay, next slide. The language in both private and public is different. And so oftentimes if you have private insurance from your employer, and then secondarily you have Medicaid, you're really working in two different languages, because what one means, the other one may not have that same conversation. So in our private world, we do have prior authorization, or PAR. In our public world, we have the same thing. But oftentimes they mean different things. So we have to really pay attention to the language, but we also need to know that in the private world, and somehow these two got mixed up. So the private listings, Medicaid CHP Plus, should be under public, and all those others should be under private, but we'll keep going. But for example, the letter of medical necessity for what they call DME, durable medical equipment, is very different. That definition of medical necessity is different in Medicaid and different in private insurance. So you have to kind of know those things. Carry forward, let's go. Okay, so what I always do is I stop and say, you may say, I want something for my kid. Okay, what is it? What's the age and stage? And who's the most appropriate funder for that item? We know that Medicaid isn't going to buy a kiddo a computer, but they will buy a kiddo a communication device. But you have to really think about where that funding would be available, what documentation you need, if you need evaluation in order to get that. All of those things come along that you need to kind of be thinking about. So it gets very complicated. Go ahead, next slide. So back in the day, in about 1965, we got Medicaid as a health insurance. It's a public health insurance plan. You can have both private, your insurer, your employer gives you insurance, and you may pay premiums on that, but you also may have Medicaid. And that's what we're going to talk about. How do we get into Medicaid? Well, Medicaid originally was for low-income adults, children, and people with disabilities. It's for pregnant women and elderly people. So just as Allison said, pregnant women get into Medicaid, people with disabilities get into Medicaid, and so do our elders get into Medicaid. But there's stipulations related to how much money they have in the bank. Everyone that is in Medicaid has the right to have one house and one car. So that isn't a problem. And Medicaid came to us as an entitlement program. It said not everybody can get private insurance from their employer, therefore we need something else to support us, and that's where Medicaid came in. Next slide. So when we talk about Medicaid, we talk about each state is very unique. Each state, Medicaid is publicly funded. The state puts up half, essentially, and the federal government puts up half. But when a state like Colorado says, yes, we're going to participate in Medicaid, they have a base of what they have to provide, and then anything additionally is what they call optional benefits. So when we talk about Medicaid, we're talking about a health insurance plan that provides hospitalization and sick care and all that other, but it also provides the home and community-based waivers because those are optional. So you're not going to find the same waivers in Utah or Wyoming or Kansas as you do in Colorado. So we're going to talk about those because those are very helpful, especially for our kiddos with special needs. Next slide. So what I just was talking about, Medicaid has that mandatory state plan benefit. That mandatory state plan benefit is inpatient care, outpatient care, laboratory service, nursing facility, home health care. All is required if Colorado is going to provide Medicaid. They also have the right, with some additional money, to provide things like prescription drugs, case management, therapies, and those home and community-based waivers. Next slide. So in order to access Medicaid, in order to access Medicaid, if a baby is born on Medicaid, that baby stays in the Medicaid house for 1 year. And then, as Allison talked about, they look at the household income and decide whether baby can stay in Medicaid or has to come out of Medicaid because the income of the household is too high. Now, there's also SSI and SSDI. So if you're in a house that is Medicaid eligible and you have a child, for example, with Down syndrome, under SSI, that child is presumptively eligible because it's a identified need, therefore is covered by Medicaid. There's also temporary aid to needy families, which brings you to Medicaid. So if you are if you've lost your house, or you're in the middle of a nasty divorce, or if you suddenly realize that COVID and you don't have the ability to pay, temporary aid to needy families is one of the areas that helps us with childcare and diapers and rent when needed. And then we have the Medicaid HCBS waivers. The other program secondarily to Medicaid is CHP Plus, Children's Health Plan Plus. And it is not as robust, it's not as big a program, and it doesn't offer as many benefits as Medicaid does because Medicaid is looking at lower income and it has a state match that makes it allowed to have a bigger benefit package. Okay, next. So why do we want Medicaid even if we have private insurance? We want it because there are no co-pays for children under 21. There's no balance billing. So if my daughter goes and buys if my daughter goes and buys a $30,000 wheelchair, which some of them are that expensive, and my private insurance says, okay, you have to pay 20% of that, then I have to pay 20% of that unless I have Medicaid. If I have Medicaid, they can't come back at me for that 20% of that $30,000. So it is, Medicaid can be secondary to your private insurance, and the package, the benefit package we're really talking about for children that is so rich and such a great package is called EPSDT, Early Periodic Screening, Diagnostics, and Treatment. So that is what allows us to not have no copays for children and no balance billing. It is also where EPSDT can step outside of the state plan benefit if it's medically necessary, but you have to pay attention to those definitions. Do we have questions in the chat box right now, Francina?
Yes, one person wants to know, what's a short way to explain what SSDI means?
I can do that in the next slide or two. So let's go on to the next slide or two, and I'll take the next question. Okay, so SSI is supplemental security income. The confusion happens in the fact that they all come from Social Security Administration, but they're different programs under the Social Security Administration. So if your loved one has actually worked in a job for a lot of years or some years, then they would go in, then became disabled, fell off a ladder, whatever, then they would go into Social Security disability insurance. But if it's a kiddo like that other mother who said, my kiddo's turning 21, at 18 with the disability, the child can apply for SSI, supplemental security income, which then would give them a stipend of money monthly and give them Medicaid along with that. So those can be applied for on the website for Social Security. So what the other piece is there are certain presumptively eligible classifications. So if you are visually impaired, you may qualify for SSI or SSDI presumptively. You automatically become eligible. Same with Down syndrome. Those kiddos become eligible immediately. If they're living in a household that's income is too high for Medicaid, then they won't get it until they turn 18. But if they're living in a house where they're eligible for Medicaid, the MAGI, what Allison was talking about, then they can get the supplemental security income. And of course, that brings them Medicaid. Okay, was there another question? I think that answered the SSDI question, Social Security Disability Insurance. And that is if you've worked. So oftentimes we get our kiddos at 18, they become emancipated. They haven't worked enough to make them qualify for SSDI, so they get the supplemental security income. But you should be able to do that within a week of the 18th birthday and start that process.
Brianne says that she understood. Thank you very much.
Okay, great. All right, next slide. So here's a little bit more on the eligibility. The applicant's eligibility is that 300% of federal poverty level. So for example, my daughter with cerebral palsy does not work and hasn't worked, and so she lives under the federal poverty level because she doesn't have any money coming in. The only money she has coming in is the supplemental security income. And most of these folks are limited to no more than $2,000 for a single person in their banking account at any one time, or $3,000 for a couple that's actually married or common law. Okay, next. slide. So the home and community-based waivers are another way to come into the Medicaid house, to get Medicaid for your kiddo. So for example, if you are a family of 5 and one child has a significant disability, then you could apply for the home and community-based service waiver for that child to get that child Medicaid. And in getting them Medicaid in a waiver, they sometimes are going to get additional services that others in Medicaid aren't going to get. But the children's HCBS waiver actually waives the income for the family and says this child, if the family wasn't in place, this child would go to an institutional level of care. Think hospital, because we don't have institutions for children in Colorado. But if for the family, that kid would be institutionalized and the daily rate would be astronomical, we would rather give the kid Medicaid at home and have the family in place than have the kid in an institution. And I think that's what, you know, most of us want, is our kiddos at home. So this was one of the waivers that my daughter was on because our income was too high for Medicaid. So her sister wasn't on it. Dad and mom weren't on Medicaid, but Lauren was, because it backed up to her private insurance, and it gave us the sound mind of no co-pays, no balance billing. Okay, sometimes there's enrollment caps, etc. Like we probably all heard about the developmental disability waiver. There are other waivers that can support besides the DD waiver. We have a number of waivers. So let's go to the next slide. So when we talk about waivers, we're talking about 3 different pieces of criteria. The financial piece, where they may or may not be looking at your income. The level of care, that's how much skilled care the child needs. So if they have a G-tube, if they have oxygen, if there's if they're not able to transfer themselves, they can't walk or move, those are all levels of care that are looked at. And then the targeting criteria that's done by the case management agency. And I'm going to give you all those agencies in the slides so that you know who to call. Go ahead. Okay, so the HCBS waiver is looking for the age range, the diagnosis, the injuries, and the region that the child. So for example, we have a brain injury waiver. For the brain injury waiver, you have to be 16 or older, primarily because they said most brain injuries occur in car accidents. And so I don't know that they understood that we ski in Colorado and you can have a brain injury sooner than 16. But it would support that person with the brain injury uniquely for brain injury all the way till 65, when they would be eligible then for Medicare. Next. So, so you also have case managers in the waivers. So if you have regular Medicaid and you don't feel you need anything else, then there's no reason to jump through the Medicaid waiver hoops. If you have a child at home that is in need of services and your private insurance isn't doing everything you need home health, you need a few other things, then looking at a Medicaid waiver would be the smartest thing for you to do. The other way you can get in to Medicaid is through a buy-in, a children's disability buy-in. And that goes up to about $120 a month. But with that, you no longer have balance billing and copay. So if the child has more than 3 therapies a week, you're already saving money. But I can go into that a little deeper in a minute. So you're going to say, gee, I really want an HCBS waiver, really want my kid at home, but I really want some Medicaid services. Then you work with a case manager to figure out which waivers are the best fit for your kiddo. And then you work through that paperwork and make sure that you meet all the other pieces of criteria. And they do an evaluation, which is called 100.2. And that ULTC 100.2. And what that means is they're looking at the child's ability to feed, dress, bathe, toilet, transfer, and be mobile. So all of the activities of daily living for that child is what we're looking for, and how much help has to be given compared to a child at the same age and stage. Okay, next slide. So some of the case management agencies that you would need to call if you wanted to go sign up for a waiver are the single entry points, those SEPs, and all of these links go to who they go to. But you can see in acronym fun there's BI, that's the brain injury waiver. There's CLLI, that's the children with life-limiting illness. The CMHS, which is the Colorado Mental Health Services waiver. The EBD, elderly, blind, and disabled, so it's for kiddos over 18 or elderly and blind. And then the SCI waiver, which is the, okay, my mind just went blank. My mind went blank, I'm sorry. There's going to be a list coming up. So if you're wanting one of the developmental disability waivers, then you go to the community center boards, and there's a link there. So different agencies monitor and manage and apply different HCBS waivers. It's one of the things that makes it so complicated. How do I get one of these? Well, I don't even know who to go to. And so it's a matter of figuring out if that's a developmental disability waiver or if it's a straight Medicaid waiver, and what your specialty area is that you need for your child. Let's go to the next slide. Or your adult, I guess, is. And then in the county world, we have the RAIs, who do case management for Medicaid. We have single entry points, as I mentioned before. We have the community center boards, which are the ones that manage the developmental disability money. They also manage the early intervention, and they have a program called Family Support that you can apply for money to buy whatever it is you need if you have a child that has developmental disabilities. And then there's county eligibility. We make this hard in Colorado because every county does it different. It's called county autonomy, but it makes it difficult because we don't always know where to start. Where's the first step? All I need to know is point me in the right direction. I'll figure it out. But that's what makes this so difficult. Let's go to the next slide. Okay, so here are all the waivers, the children's waivers and the adult waivers. And the SCI is spinal cord injury. Yay, she remembered finally. So let's look at the kids' waivers. The children with life-limiting illness waiver is really looking for children that have some disease or identified diagnoses that says they probably won't live all the way till their 18th birthday. So in order to get on that waiver, you have to have a doctor say, yeah, this child may not survive a full 18 years. But what you get, the services you get under that waiver are things like grief therapy, you get art, music therapy, you get things that children that are critically ill would enjoy and families can benefit from. The Children's Extensive Support Waiver is managed by, and this is the next one under the children's waiver, it's managed by the community center boards. And it's for kiddos with high behavioral needs. It is for families who are keeping their kid in their home, but this child may not sleep through the night. This child you have to be line of sight. The child has to be able to be seen at all times because they may harm themselves or others, or they run out into the street. So the CES waiver is for high behavioral needs. The next waiver is Children's Habilitation Residential Program, CHIRP, they call it CHIRP. That waiver has seen a lot of changes. It too is for kiddos with high behavioral needs. Is there somebody with a question? Is there somebody with a question? Okay.
I believe it was a mistake. All microphones should be turned off and questions should be shared through the chat.
Okay. So, and then finally, so the CHIRP waiver, it used to be you'd have to relinquish your child to foster care in order to get the CHIRP services. That is not the case anymore. You can keep your child at home and get those habilitative services. The final waiver is the one that doesn't look at income. So if a family is over income for Medicaid, but the child has a significant disability, they would qualify for the Children's Home and Community-Based Service Waiver. And that would give them Medicaid and access to other services like case management. And then in the adult waivers, and we are the state with the most waivers of any state. The adult waivers, there's a brain injury waiver, starts at 16, provides things like home modification, because chances are if the individual has now acquired a brain injury, they may need modifications to the house or bathroom, grab bars, whatever it is. There's a community mental health supports waiver for adults. There's a developmental disability waiver. Sometimes you'll hear that referred to as comprehensive waiver. It's the one with the long wait list. It's run by the developmental disability, the community center boards, but it's really looking at a placement for that individual, a group home placement for life, that the agency would then be involved with your kiddo, and the child wouldn't necessarily live with you anymore, but maybe in either a group home or a host home, somebody else's home. So then there's the elderly, blind, and disabled waiver, where if you can't get on the DD waiver, the elderly, blind, and disabled waiver has a lot of the same modifications, services, but it's not comprehensive. It doesn't also offer housing. But the elderly, blind, and disabled waiver allows for an individual, say at 21, 26, to go to a day program, to go into the community and have outings, to have have Medicaid and other services. The spinal cord injury is a waiver specifically for folks that have acquired a spinal cord injury, and so often you'll see them coming out of the hospital with that waiver in place because there's home modifications, et cetera, that are needed. Finally, the supported living services waiver is the developmental disability waiver that allows 18 and older to go into the community and have services in place, mentoring, job prep, some of those kinds of things. And that is also administered through the developmental disability or community center boards. The chart at the bottom is actually a chart of all of these waivers, who you call, what services they offer, all of that kind of thing. If I put it on a slide, you wouldn't be able to read it. It'd be such tiny print. So I just gave you the link. Go ahead to the next slide. So there are also on Medicaid healthcare policy and financing websites things like side-by-side comparisons of the waivers, so that if you're not sure, but you think your child could or should qualify for a waiver, these might be helpful. Family Voices can also answer your questions, as can El Grupo Vida. But what you're really looking for is, what do I really want? My kiddo's aging out of the school system. They're going to be home. I want some activities for them. I still see them living at home with me for at least 5 years. So we don't need the DD waiver, but we would need like SLS or EBD in order for that kiddo to have some services along the way. And those can be applied for at 18. All right. Do we have a question in the chat box? I'm seeing a new one.
Yes. Brianna asks if there is a waiver that allows you to access an expert outside of the state that provides the care that your child needs.
So there are, that is under EPSDT. So if you have Medicaid, then you can go through EPSDT, the early periodic screening, diagnosis, and treatment. One of the things you have to prove in today's world is why there aren't those experts here that you're finding in Texas. So what is it that they can do that we can't do here? But EPSDT would be helping you figure that out. So let's see, can we, Francina, maybe you can type and we'll put Gina Robinson's phone number in the chat.
Okay.
She oversees EPSDT in the state. 303-866-6167. So that's where you would start with accessing what's needed in order to go to Texas. But you would have to be able to prove, and that's really tough, that there isn't that same specialist here in Colorado that can do the same thing. But that's a great question, Brianna. Okay, so in Medicaid world, they're showing you that there are different waivers. And so today, so far, we've shown you that if you're pregnant, you can get into the Medicaid house. These are the ways with the HCBS waivers that you can get into the Medicaid house, whether you're over income or living with Medicaid, but you need additional services because your child has more needs than is being provided, like behavioral health services. And then we also have talked about the children's buy-in. Let's go to the next slide. I don't know that I put that into the slide deck. Okay, so in health record keeping, and this is one of those things that I wish I had done a better job as I was raising my daughter, but I kept a notebook of all of her big medical records and her CD-ROMs and things like that, all in one book, so that I would have a place with the thought that I won't outlive her, that I would have a place to keep the record keeping. I also did a list, a page that helped me with all the medications she's on, a page that helped me with all the services, all the hospitalizations and things she's had, so that I could keep it organized so that when I'm asked, I can create that. The blank medication list is up on Family Voices website. It's familyvoicesco.org. And some of those things, including a letter of medical necessity, are up there. And the record keeping just helps you so that you're not going backwards and trying to figure out, now what did I do and who did we see and all of that. Next slide.
There is a question. I don't know if I should. Okay, the question says, what is the name of the program for children that have behavioral complications, like they cannot sleep and they have to be under watch all the time?
Okay, so that is Children's Extensive Support. And to get that ball rolling, you would need to talk to your community center board, which is different in each county. If you tell me what county, I can tell you what community center board. What county? Do we have a county?
I think Arapahoe. There was a typo in the chat, but it's a county with A. It's either Arapahoe or Arvada.
Is it Arapahoe or Adams, or Arvada is a city but not a county? So I need to know which. Arapahoe, yes. Developmental Pathways is who you would call to ask about the CES, Children's Extensive Support Waiver. And their phone number is 303-360-6600. Again, 303-360-6600.
Thank you, that person says.
Okie doke. Next slide. So one of the reasons I'm going to tell you to always, always, always get your denial in writing is because if you don't know what you were denied or why. But we often get denials and the timeline is pretty short to get to an appeal. So if you get a letter that says, nope, you've asked for this and you're not going to get it, then we need to get that appeal moving almost immediately. But the paper in writing, if they won't give it to you in writing, you need to say, please, I must have a denial in writing, or I don't know what I'm appealing. But for example, some systems won't give you a denial because they know they're supposed to have paid for it. So that's the other reason I always push to get a denial, so that you know why you were denied, because it has to be in the letter by law, and then what the job is that we need to do to fight for that. So always ask, no matter what system you're standing in, could I have that? Could I have that in writing? Is exactly what I do. I say that. Okay, next slide. So when I'm calling insurance companies or whatever, and we Family Voices does this a lot. We do three-way calls with the hospital or with the insurance company or with Medicaid to ask the questions. I always have this information ready, and I keep track of it because oftentimes you'll get disconnected and they don't call you back and you've just lost a whole hour of your life. So I always am ready with the full name, the insurance ID, the date of birth, no matter whether I'm calling Medicaid or private insurance. I'm going to ask, who they are and their phone extension so I can get back to them. And I'm going to keep that in a journal because the very first thing that happens when things go not well is Medicaid or the agency, the insurance company will say, well, who did you talk to? And if you don't have all that in place, we're not creating that paper trail. We're not going to get where we need to go. Recently, I had a mom say, I've got all these problems and they just won't correct the spelling of my son's name. And so then I don't get the pharmacy medications because they say that's the wrong kid. And this had been going on for months and months and months. And when I called her to say, well, who all have you talked to? She was like, she gave me like a list of 10 people that she'd talked to and contact and everything. It really made a huge difference in what we could do to fix the problem for her. And we all get very, very frustrated, but I just tend to have a spiral ring notebook that I just keep all that stuff in. And that way, when I'm doing my insurance calls, I can keep track of it. Okay, next slide. So we're now at, does anybody have any questions? And we could go back, we've got some time, we can go back and do some more on the waivers. Or I can, there is a Medicaid buy-in for children that even if you have private insurance and you're already paying premiums, if you buy into Medicaid, you're going to get home health that private insurance doesn't cover. You're going to have no copays, so you don't have to pay that $10 or whatever every time you go in for a therapy or whatever. You're going to not have any balanced billing, so if you come out of the hospital and there's several $1,000s you're supposed to be paying. If you have Medicaid secondarily, you cannot be billed. So I'm going to wait a minute and see if anybody has any questions or wants to go back over any part of this. So far, nobody's asking for anything.
Maybe you would like to expand a little bit more on the needs of children that don't sleep well through the night and the services available to families in those situations?
Okay, so the children with extensive, so it's Children's Extensive Services Waiver. And what they're looking for in those kiddos is behavior that creates the child to not be able to sleep through the night, that and if you give them melatonin or something that's over the counter, you have to say, then they sleep through the night, you won't qualify for you. So you really have to show that the kiddo really doesn't sleep through the night. But that CES waiver provides for therapy, it provides for home modifications, it provides behavioral services, but so does straight Medicaid. Medicaid, if you go in through the income. And hold on, I'm looking to see what else it's covered. So it does adaptive therapeutic recreation fees. It does assistive technology, which is communication devices and things like that. It offers community connector, so going out into the community with somebody that's has a behavioral background so that they can support the child. Home adaptations, homemaker services, so that's like helping clean the child's bedroom and the areas that the child lives in. They're not going to clean for the whole family, but they'll clean for the child. Parent education, hippotherapy, which is horseback therapy, which sometimes really works for our kiddos, and things like massage, movement therapy, respite, which most of the families that have a kiddo that's 24/7 and doesn't sleep through the night, they need their respite. They need supports. Specialized medical equipment, if they're still in diapers, past age 5, they'll help pay for the diapers and the wipes and things like that. And any kind of vehicle modification. They won't buy the van, but they'll buy the modifications for the kiddo to sit safely in the van. The CES waiver is one that you would contact your community center board. You would say, I heard from Family Voices, I heard from Christy Blakely that there's a CES waiver and I would like to apply for it. The first thing they do is come out and evaluate your home and meet the kiddo, and sometimes now I think they do them on Zoom, but they're going to ask what you want. What is it that you want? And you can be, pretty frank about, well, I'd like a good night's sleep. And my kiddo is line of sight. I can't ever let him out of my sight or her out of my sight. She'll run out the front door. So maybe we need a hook that's higher, and that's a home modification. Or maybe we need a camera to make sure that she's safe in the room. Another home modification technology-wise. So case managers are supposed to help you figure out what you need. Sometimes it takes another parent, or you can call Family Voices and say, do you have any other ideas? Because sometimes the case managers don't share everything because they think you're going to then take everything. And what we really need is what's specific to that child and what I need for that child. So it may be an adaptive bike to wear off some energy, or I really need help with diapers and wipes right now, or I really need help with respite because I'm myself going to have something done and I need somebody to back me up with this kiddo. So the CES waiver is really that waiver that was created for those kids. And then the children's waiver, the children's HCBS waiver, was built for kiddos like my daughter, who has cerebral palsy and is nonverbal, uses a G-tube to eat, all those medical things. That's what the children's HCBS waiver is all about. But if you're already in Medicaid, you can get behavioral services through Medicaid. So then why would you go to CES for all those other services that I just talked about, the therapies and all those other things that you can get besides just Medicaid?
Okay, thank you for that answer. I don't see any other new questions, but I was also thinking, I have heard, and this is a question of mine, and I don't know if other people might share this question with me, that depending on the organization, the waiver that you can apply to, not all organizations manage all waivers. So what can you tell us about that?
That is very correct, Francina. All waivers don't manage, all agencies don't manage all waivers. So if you want the CES waiver, you have to go to the community center board. And so it's confusing in how do you know who to go to. And for the children's HCBS waiver, one of the first things you have to do is go to the county and show that you don't qualify for Medicaid, because that's all that you're going to get under under that waiver. If you just don't know who to start with, then on those case management slides, I would say either start with your single entry point or your RAE. And if you don't want to talk to either one of them, you're welcome to call Family Voices and we can figure it out. We make this so confusing for families, and our hope is to make it more streamlined, make it easier for families. But because we have counties all over that are, everybody does something different, you don't always find who can answer your question for you. So let's see, in the Department of Healthcare Policy and Financing is also one of the places that you can go for most of these waivers, because they administer most of these waivers, but they don't do the intake. They don't do the applications and things. So they're going to send you to the single entry point or the community center board or to the RAE, the regional accountable entity. Okay.
Thank you for that. Some people in the chat are saying that they cannot listen to the interpretation, but it was just now as you were finishing what you were saying. Okay. So I'm going to go ahead and let's show people the website. And what you say in English, I'll say in Spanish. And we will close the session like that. Okay. Lo que vamos a hacer ahora es que vamos a mostrar la página web de Family Voices, y aquí hay muchos recursos que ustedes pueden utilizar. Entonces, Christy va a hablar en español, en inglés, y yo voy a hablar en español.
So if you go down to Guides and Resources, right up there, Francine, at the very top above the heart.
Camera. Guides and Resources, yes.
Yep. Mm-hmm. So you'll see that there's the HCBS waiver, so there's more information about that. There's medical resources. There's age and stage guides about what should I be looking for, and seizure protocols. There's the blank medication that she's on, the medical resources. That blank medication schedule is, I use it for my elderly dad. I use it for myself. I use it for my daughter. It's a way to list all your medications and not have to remember them all. And then I just update it on a regular, it's in a Word document that you can just download.
Yes, and I'm going to go ahead and translate. Esta es la página web de Family Voices. Aquí hay muchos recursos muy útiles para las familias, especialmente aquí donde dice Resources and Guides. Y si ustedes dicen, bueno, pero eso está en inglés, este botón que está aquí dice Translate, usted le da clic y elige la bandera de España y automáticamente va a ver el contenido en su idioma. Entonces es muy útil. Aquí está todo lo que usted puede necesitar. Me llevó de nuevo al inglés. Pero esta página es muy, muy útil. Entonces les recomendamos a las familias, aquí pueden descargar lo que es hojas en blanco para llenar lo que es la medicina que necesitan sus hijos o hijas y acceder a muchos otros recursos útiles. Go ahead, Christy.
So scroll down. One of the things on the web page that's important is right, whoop, up. It's called Parents Encouraging Parents. That is a conference that our school, our public, I'm sorry, I'm not saying it right. Our Division of Education puts this on, CD, Colorado Division of Education, puts this on every year a couple times, and it's a weekend away. They pay you, they will pay for your child care. So it's a way to get away for the weekend. They normally have them in pretty nice locations. And it's a way for you to learn about systems and how to navigate those systems for your child. But it's also to meet other parents and connect with other parents that may be in the same journey that you are with a kiddo with special needs. We're very unique in doing this, and PEP is really a delightful service that Colorado Department of Ed offers. So please don't miss that if you have the chance to do that.
So I'm going to go ahead and translate that piece, and then
Yeah.
I'll give you the word so that we can close the session.
Okay.
Esta parte aquí que dice Parents Encouraging Parents, son padres que están motivando a otros padres. Entonces es un grupo de apoyo donde los padres comparten algo en común, que es que tienen hijos con necesidades médicas muy especiales. Entonces aquí hay un enlace para registrarse. Y si ustedes se preguntan, bueno, pero ¿qué tal si ahí no hablan español? Pues algo que yo les recomiendo es que se hagan notar, porque los espacios para personas que hablan español nunca se van a abrir si no nos mostramos en esos espacios. Entonces, llene la aplicación, seguro que va a haber un espacio de poner un comentario, le va a preguntar el lenguaje o idioma que prefiere y ahí elija español. Pero esto es de mucho provecho para las familias, para no sentirse solas y poder conectar con otras personas en su misma situación.
And I want to go back to Rosa, who was asking about her 21-year-old getting into a waiver. If he doesn't have Social Security, supplemental security income, then we want to have him apply for that.
I'm going to read that part in Spanish so that I don't forget.
Mm-hmm.
Rosa, está diciendo Christy que si tu hijo no tiene los ingresos a través del Seguro Social todavía, ese puede ser el primer paso que deben tomar. Go ahead, Christy.
So what I also would recommend is that she contact for the single entry point, contact the single entry point, which in Denver County would be Colorado Access, to get him started applying for the EBD waiver, the Elderly, Blind, and Disabled waiver.
And I'm going to say that part. And then, y luego, Rosa, que debes contactar a tu agencia, que es un punto de entrada único, para averiguar sobre esa exención o waiver para personas que sufren de ceguera u otras discapacidades. Go ahead.
So if anyone has any questions, call Family Voices, call Grupo Vida. They can answer the questions and hopefully support you in the journey that you're going through and the questions that come up, because what we've seen is new questions come up at 18 to 21 that we didn't have, but we were having others at age 5. So that's one of the reasons why Family Voices supports the continuum, especially in this hard time of COVID. So,
si ustedes tienen preguntas, dudas, no duden en llamar a Family Voices. Family Voices y el Grupo Vida colaboran para que si una familia que solamente habla español hace esta llamada, no va a estar solo. El Grupo Vida le va a acompañar y con la experiencia tan vasta que tiene Christy, vamos a ayudarles a encontrar respuestas a sus preguntas. Christy, can you share with us the phone number so I can put it in the chat?
Oh, yes, it is 303. Local number is 303-877-1747.
Ok, el número de teléfono está en el chat, es 303-877-1747.